All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Saran Court, Dublin, California 94568. Phone number 408-687-1899. Email address homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime when you are suffering from any disease at any age and you are desperate from your treatments, please give me one call at 408-687-1899 to just discuss your case and have a second opinion about your disease and about your prognosis and the results. I can guide you according to the natural principles. And those natural principles are based on the provisions that when there was no medical science, what is that? We have learned from the nature. We have learned from the nature and we have experimented it and we have verified many things during the course of this health and how it is deteriorated and how we can bring it back to the health. All those measures which we have adopted throughout the course since our records are maintained. Since the records are maintained, we have a record that what we were doing and from where we learned, from where we started. We started from the nature. When there was no medical science, how the nature was curing. Even then, since the life has created on earth, since then it is suffering from diseases. Since then it is facing many hurdles to go in a normal way. It's not that easy for the life to go. He has to pass many hurdles. Even when I was discussing about the pregnancy and all those things, you might have heard that there are many obstacles in the way of getting pregnant and sterility and all those things. And I have described everything one by one in this course. That's what are the hurdles over there. Why still people are having sterilities, male sterilities, female sterilities. These are all the hurdles. And nowadays, the medical science with its research and approach, they have find out some other alternatives. Other alternative means how the nature was doing this pregnancies, how the nature was creating a new life from life. Then now we are artificially able to create those things. Artificially, we are able to create the life from life. Even then, we have to use the measures of male and female the same way, the sperm and the ovum the same way. But even then, the hurdles are there. Many of the hurdles we cut across this course, that how the sperm meets with the ovum and how they travels later on, how they meet and how they progress, how the life was going on. All these things we have discussed in these lectures systematically. But now we have cut short the process because that meeting point, that the meeting of ovum and sperm, we are making it artificially outside. And ultimately we are just installing just like a small plant we take from the outside, and then we put the seeds in one pot, and then after that when it grows we put the plant in the other places, and then it grows and ultimately reaches to the flowers and the fruits and the seeds and everything. And that is the same thing. We are thinking on the same lines that this life has been passing through these programs by the nature, and we are now able to uh, fulfill those requirements what the nature was doing artificially outside the body. And ultimately we are installing that flowering plants, or the plant which is ready to be a flower ready to grow in the uterus of the females. And ultimately most of the hurdles which were before that has been covered. And after that, many of the hurdles life has to pass through in the uterus when it is developing inside the mother's womb. And ultimately we have discussed systematically, one by one, all these things. And then after that, when this body was structured, the whole body was constructed, and after that we have started again finding out the basic contents of this body, how this body was formed, and basic unit of this body, and everything we are discussing systematically. And last time, and in my last lecture, it was in Hindi, and I was discussing about the abdomen. Though the lecture has been given in Punjabi, and now we are yesterday it was in Hindi, and now today we I think in English I have already described it that, but even then I can repeat it before going to the third portion of the abdomen. Just like everybody is aware of that, that the under the neck, the whole body up to the legs is known as trunk, and the trunk was divided into two portions. The upper portion, which is covered by the ribs, is known as chest, and the portion of the abdomen, portion of this trunk under the ribs, is known as abdomen. And then abdomen internally, not externally, because externally is the same abdominal wall, abdominal muscles, because the muscles binding the chest are different. They are pectoral muscles, whereas the muscles binding the abdomen, they are different. But the chest area was covered by the supported by the ribs, whereas there are no ribs, there is no bony structure except the vertebral column in the backside. In front, there are only muscles, and this abdomen is supported by the muscles and covered by the skin. This whole area up to the skin is known as abdomen. But internally, as I told you, that internally this abdomen is also divided into two portions, and one of the major portion is known as the abdomen proper. The other portion is known as pelvic girdles or pelvic area. So yesterday, when I was discussing about these things, that to easy understanding about the abdomen, I have divided the not I means anatomy, because I'm describing the anatomy structures, which has in our knowledge when we study the anatomy of this body, and we have described easily to understand this body. First of all, we divided this abdomen into four different quadrants, and the lines were passing through the umbilical cord. One line was passing transversely from right to left, passing through the umbilical cord, and one line was passing from upward to downward, that is known as the mid-sternal line, from the sternal bone downward, which was passing through the umbilical cord downward, and the abdomen was divided into four quadrants. But even then, it is easy for the doctors, but for all other peoples to know about, because there are different organs, portion of the different organs is passing through a different area of the abdomen, and to understand that, it will be more better if we can divide the abdomen into nine different parts. So to divide this abdomen into nine different parts, yesterday in Hindi lectures, I given the briefing of that one, that first of all, under the ribs, subcostal plane, under the ribs, where ribs are ending, though ribs are going even up to the level of the abdomen, and they are covering some portion of the abdomen only, but those ribs are floating ribs, but even then they are. So I'm telling you about this one, that subcostal plane is the line which is drawn from the lower end of the last rib underneath. Last rib, and they are matching in the abdomens here from right side, from the lower portion of the lower ribs, and left side, it goes to the left side, and that is known as subcostal plane. And after that, you know that when it is going up to the ribs, still there is a portion of the abdomen, and portion of the abdomen was there. And after that, we draw another line that is known as transtubercle plane. And that transtubercle plan was taken from the right tuberosity, iliac tuberosity, to the left iliac tuberosity. And the about the tuberosity, I told you about that one, that there, wherever you put your belt, pent, belt of the pant, and the highest portion of your hip bone inside the abdomen, you can trace it by your thumb, and then you will see that is the highest crest. That is known as the iliac crest, because there are three bones making the pelvic brim, making the pelvic area. The ischium, where we sit down and then it is touching to our seat, that is known as the ischium bone. And when in front we where buckle of our pant is, that is known as the pubis bone. From both sides it's coming and joining in front, that's the pubic bone. And the highest portion on the sides of the hip, which makes the major portion of the hip structures, pelvic girders, and that is the ilium bones. And the top of the iliac bone is like a tail, and that is why it's known as the iliac crest. And on that iliac crest there is a projection, there is a some developed portion that's known as the iliac tubercle. And from iliac tubercle right side to the left side of the iliac tuber, if we draw a plan, that is known as transtubercle plan. And now with these two plans, we have divided the abdomen into three portions: one below the tubercle plan, one above the subcostal line. Okay, so and there is one middle area. So these are three portions. But now for these three portions, if we draw another two lines from upward to downward, and those are known as mid clavicular lines. Clavicle is the bone that is known as just under the neck, you can say, the first bone under the neck before the chest starts, that's a clavicle bone, which unites the this chest bone, that's the sternum in front, and on the side it is united and form the shoulder joints. It helps in making the shoulder joints. So this is the clavicle bone. So from the mid of the clavicle bone, if we draw and throw downward two lines, these are known as the mid-clavicular lines. So already the abdomen was divided by three portions: upper portion, middle portion, and the lower portions. And all these three portions I am dividing into again into nine portions by these two lines, which are coming from upward to downward as a mid-clavicular line from the center of the clavicle bone. So ultimately, they are going that, and when these three portions are crossed by these two lines, the abdomen automatically is divided into nine different portions. The upper right portion is known as hypochondria, right hypochondria. The upper left portion is known as left hypochondria. And these are also given another name: hepatic area, right hepatic area, and left splenic area, because the major important organs which are lying in these areas are the liver, mostly on the right side, though it goes to the left side. It's also in the middle portion as well, but most major portion of the liver is lying on the right side under the ribs. Remember, I told you that most of the liver is lying underside the ribs. It is not palpated outside, but abdomen and the spleen both are the organs of abdomen, and they take place. They push the lungs upward inside the ribs, so they take a shelter of the ribs to be protected. Spleen and the liver. Spleen on left side, liver on right side, they are protected by the ribs, so that they should not be hurted, injured easily. So that is why they are the portion of the abdomen. But here, this the base of the lungs becomes like a dome shape, and under the dome shape, the liver is fixed in the right side, and spleen is fixed on the left side, just like a dome globe. So in this way, the middle portion was known as the epigastric area between these two lines, which are going from upward to downward, which we name as a mid-clavicular lines from the center of the clavicle going downwards. So middle portion is known as epigastric area. So upper portion from the subcostal line, sub means underneath, costal means ribs. Subcostal line, upper portion of the abdomen is divided into three portions by these two lines. Right is known as right hypochondriac region and also is known as hepatic region, because the major important organ is the liver. Hepatic means liver. So, and the left side has the main organ, that is the spleen, but there are other organs. I will just tell you in this program in English. And the middle portion is the epigastric. Gastric means stomach, and epi means above. Ab, uh, Epigastric means above the gastric, above the stomach area. That is known as epigastric area. So there are some other organs. I will just let you know about this one, but let me describe all the nine portions of this abdomen. So now, underneath the subcostal line, there is another portion up to the transtubercle plane. From the subcostal line to the transtubercle plane, there is another three portion of the abdomen has been divided by the lines which are drawing from upward to downward, subclavicular lines. In this way, the right side area is known as right renal area, and left side area is known as left renal area, and in between that, which is the umbilical area, that's known as the umbilical area. The central portion of the abdomen is known as umbilical area. And underneath the transtubercle plane, where we put the belt, underneath the transtubercle plane, where there is inguinal ligament, the lower portion is known as the pelvic area. So that pelvic area has again three portions: right side, left side, and the middle portions. The right side area has the inguinal canal in it, and I have described yesterday very detailed, but I will again describe it in English as well. That when this child is in the mother's womb, developing before the delivery, the testis or the genital organs, you can say, the testis mostly remains inside the abdomen of the child. Though the child is inside the mother's womb, in the mother's abdomen, and the testes of the child are still inside the abdomen of the child. But as the pregnancy approaches to 8th month of the period, 32 weeks, you can say, 32 weeks pregnancy, these testes descends down from the abdomen to the testis, but they are still in the mother's womb. Remember, they are still in the mother's womb, and the testis from the abdomen of the child descends down, male child, descends down to the scrotum, outward the abdomen. And that the via, they go by the inguinal canal. There is a canal, there is you can say, pathway for these testes to go into the scrotum, and overneath there is a beam of the inguinal ligament. That inguinal ligament is attached to that tuberosity which I told you above the umbilical crest, iliac crest. There is a tubercle, and that tubercle, that this inguinal ligament is attached on right side, this inguinal ligament is attached on the left side tuberosity, and they are joining in the symphysis pubis, and they are making a beam. Underneath this beam, underneath this beam, these testes crosses into the scrotum. The scrotum is a folded skin, extra skin coming from both sides of the abdomen. As I told you, there are three muscles. First of all, and the oblique type of two muscles, just like a curved oblique types, from downward, right side to left side, from upward, from the right side to left side, and then to cover up these two muscles, a transverse abdominis muscle is covering up all these arches muscles of the oblique muscles. And then after that, to bind these things tightly, there is a rectus muscle which is going from upward to downward. So in this way, the abdomen was tightly bounded, so that there should not be any rupture if there be any gas formation. And even in case of females, if there is the pregnancy, or even in case of disease, there is the ovarian cyst, they may enlarge up to the big portion, just like a baby in the womb. So in this way, these are elastic muscles, and these are bounded by these T layers: internal oblique, external oblique, transverse abdominis, and the rectus muscles. So all these muscles are binding the this abdomen to make it tight, so that it should not burst out. And it has elasticity, it can enlarges maximum strength. But ultimately, I'm telling you that these nine portions, the right inguinal area, the left inguinal area, and the lower portion in between, under the umbilicus, and under the symphysis pubis, this bone or the inguinal ligament, the portion is known as hypogastric area. Hypo means under, gastric means stomach. As I told you, the stomach is a J type organ, starts just under the where the ribs are dividing, starts from there. There is a about 1.5 inches, about 2 inches area of the esophagus, and underneath that esophagus joins with the stomach, and then from that one, it is J type. The lower portion is like a J, English word J, that even may extend under the umbilicus, or may extend the umbilicus up to downward. So maximum area it covers when it is especially full with food, or we are standing. Its position changes. When we are lying on the bed, its position is changed. When we are standing, its position is changed. When we are full of food, its position is changed. In this way, that's why it is considered that the stomach area, or the stomach organ, is descended down even under the muscles, inside the abdomen, under the below the umbilical cord. So that is why the pelvic area under this inguinal ligament is considered as hypogastric area, means under the gastric area, under the stomach areas, because main organ is the stomach, just to understand for that one. But when I was describing the inguinal area, I told you on the right side inguinal area, there are a different structures, just like the femoral vein, inguinal canal, and even the in the middle area, there is a there is a fallopian tube, there is a ovarian ligament, there is a ovary, and there is a uterus as well. The uterus is hypogastric area. Uterus lies just in the middle, below the umbilical cord, in the pelvic area. So this is known as hypogastric area. But still, there are many more other organs I will like to discuss with here, that when we are discussing about the organs, I have discussed just only on the right side. So these are nine portions. Nine portions has their different organs, though their name is named by the major organ they have. But other than the major organ, there are other organs lying in the same areas. Let's start with the right side area. So just I told you that this is known as right hypochondric area. And right hypochondric area, I'm missing my board. If I see, I can make it a drawing. Or okay, no problem. I can make it tomorrow, and for this one. But everything has been discussed in Punjabi, in Hindi, and also I'm describing it now in English. But I will show you this sketch as this sketch advances further. So right area under the ribs on right side where liver is lying, that is known as right hypochondriac area. But not only the liver is lying in this way. When the large intestine is going from downward to upward, it passes under the liver, and it passes under the liver, and then it turns under the ribs towards the left side. So that turning point of the large intestines is also there, that is known as flexor, and its name is hepatic flexor. Hepatic means liver, flexor means a turn, where large intestine coming from downward to upward turns to left side, that is hepatic flexor. It means it means the some portion of the ascending colon of the large intestine, that's known as colon, because the whole large intestine is made up of colons and flexors. Colons, that area, flexors means turns. Wherever it turns, it is known as flexor. So when large intestine starts from the lower portion, where it joins with the small intestines, then from that area, that's known as cecal area, I will tell you about this one. From that cecal valve or cecal area, it goes upward, that is known as ascending colon. And that ascending colon, which reaches upward under the liver, some portion of the ascending colon lies in that area, plus there is a turn that is known as hepatic flexor. Then this large intestine turns to left side, and that's known as transverse colon. So some portion of the transverse colon, some portion of ascending colon, some portion of transverse colon are lying in this area that is known as right hypochondriac region, or contra means ribs. Con- right hypo under the ribs, this portion is known as right hypochondria as well as the hepatic area. And then plus under the liver there is a gallbladder. Everybody knows, and if whatever I have described previously, that most of the organs inside the body are working 24 hours since they are generated. Remember, I have told you about that one, that at the fifth week, this heart starts working, start formation, and ultimately at the 16th week, it is working. We can see the palpations with special organs, but at 20th week, we can see by stethoscope that heart is working. And the same way, all other organs are formed up to the 20th week of pregnancy inside mother's womb. And since any organ is formed, any organ is complete in its formation and working, since then they continue working till the end of the life. Till the end of the life. But functioning sometimes may start, but there is a special movement in every organ which shows the life of those tissues is still there, and that is known as palpation, or that is synchronous with the heartbeat. Gallbladder, liver, whatever organs are in this area, they are continuously working. Since they are formed, they are continuously working in this area, and they are moving. And working means, what's the function of the liver? The function of the liver is uh, just to secrete bile. Every organ has secretions and excretions. Secretions are Secretions and excretions are basically the waste product of every organ. And basically, these waste products are not normally you known as the actually waste product, because these are divided into two forms. One are secretions, the other are excretions. Excretions of the body are those which are not reused after they are excreted, just like stool and urine and sweat, or perspiration and breathing, they are not used. Whereas the secretions, I'm talking about the excretion. These are stool, urine, all these things, sweating is a excretions. But there are secretions. Secretions are coming from every organ, maybe within the blood, maybe by any other means. Just like the bile is secreted by the liver, the main function of the liver is to secrete bile. It is continuously secreted, and it is continuously, when we are eating, it goes directly to the intestine. That's a portion in the first 10 inches of the small intestine, that the portion is known as duodenum. And in that duodenum there is a small area that is known as ampulla of Vater. That ampulla of Vater has a combination joint of pancreas and as well as of the bile duct. So liver, since it is start working, continuously liberates bile, and that bile, when we are eating, it directly goes to the intestine via the common bile duct. Common bile duct is known because it is directly getting from the liver. Also, it is getting bile from the gallbladder as well. So that's known as common bile duct. But there is a bile duct which comes from the liver and goes to the gallbladder. And when we are not eating at that time, because liver is continuously working, at that time that secreted bile from the liver goes and stored into the gallbladder, which is a hanging pot under the liver. That's a gallbladder. So this is what the main function of this one is. And these two organs, the liver as well as the gallbladder, lies inside the ribs. And the area is known as right hypochondric area. If they are having any problem, liver is enlarged, gallbladder is distended, have more content into that one, they comes outward from the ribs. Easily examinations, when we examine the ribs, under the ribs there is, I will tell you how to examine all these things later on. When you see there is a palpation, we can see the liver area or we can see the gallbladder. It's a painful, having any problems, and it is felt under the ribs area. That's problem. So I will tell you how we can identify the different pains inside the abdomen. So just I am telling you what are the organs. So first thing I told you, in the first organ, the right hypochondric area has main portion of the liver plus the gallbladder, and also some area of the ascending colon of the large intestine, means which is going from downward to upward ascending. And there is a flexor, there is a turn of this large intestine from right side to left side, and plus some portion of the transverse colon. Transverse colon means the area of the large intestine which goes from right side to the left side of the abdomen. So some portion, it starts from there. There is a flexor, hepatic flexor, and some portion remains in the hypochondric region up to the level of mid clavicular line of the right side. Right side mid clavicular line Up to that area, the area of transverse colon lies in right hypochondriac area. So these are the most important organs in right side under the ribs. They are not mostly palpated if they are not having any problems. But if they are having any problem, then they come under the ribs and we can palpate it in the abdomen. That's a painful area. I will tell you how to examine this one. But let's come first of all, calculate all the organs. And now the second area in between these two lines, we have drawn two lines, mid clavicular, from the clavicle area, mid clavicular line, which are going downwards. In between these two lines in the abdomen, in the middle area, just above your umbilicus, that is known as epigastric area. And I told you why it is known as epigastric area, because the stomach is lying. Gastric means stomach. So stomach is lying under this area where the ribs are separating, and there is no sternum. So in that area, this is known as epigastric area, and it means the most important organ lying in this area is the stomach. But not only the stomach, there are some other areas, some other things which are in this epigastric area. First thing, I told you the upper boundary of the abdomen is known as diaphragm, which separates the chest and the abdomen area. That's a membrane which separates the abdomen and the chest, that's known as diaphragm. And the food pipe, because there are many openings which allow the vessels coming from upward to downward, and vessels coming from downward to upward, from abdomen to chest, or from chest to abdomen, you can say that one. They are passing through this diaphragm, and there is a food pipe also that is known as esophagus. Esophagus passes from this diaphragm from chest to downward in the abdomen. And when it passes from the diaphragm and reaches up to the stomach, there is a area about 1.5 inches to 2 inches area approximately to join with the stomach. To join with the stomach, it means that 1.5 inches area of the esophagus is also in this epigastric area. I will tell you what's the big importance of this 1.5 inches area of that one. When people are having acidity, when people are having gas formation, and when people are having a pain in this epigastric area, this is the big important area of this one. And this junction with the stomach of this esophagus is known as cardiac orifice. Orifice means hole. Which hole? Where food pipe is joining with the stomach. Food pipe is coming from mouth downward, pharynx, and then the esophagus, and then esophagus is passing through the diaphragm and joining the stomach. And that joint is known as cardiac orifice. Orifice means opening. Cardiac means heart, because it is near the heart at that time. That is why, just to remember, the anatomist give this orifice the name as cardiac orifice, means close to the heart. So in this way, this important area of the epigastric area where stomach is lying, plus there is a 1.5 inches of the esophagus area, plus the cardiac orifice is there, and plus there is a first portion of the small intestine in this area, that is known as duodenum. And the portion of the duodenum is also lying in this epigastric area, because up to the level of the subcostal line. Subcostal line means under the ribs we have drawn a line. So in this way, up to that area, in this duodenum, because duodenum is like horseshoe, it is like a horseshoe, and curved like. And in the curve of this horseshoe, there lies the pancreas, or head of pancreas is like a fish, head, body, and a tail. So, head of the pancreas, which controls our sugar level inside the body, is also here in the epigastric area. Remember, if anybody says pain here, then doctor has to diagnose whether this pain is in the esophagus, whether this pain in the stomach, whether this pain in the duodenum, whether this pain is the pancreas, whether this pain is connected with the bile, all the liver sides. So all these things I will let you know one by one how you can differentiate all these things before going to the doctor. Before going to the doctor, what are the signs and symptoms, so that you can identify, oh my, this pain is related with the liver. Oh no, my, this pain is related with the pancreas. Oh no, 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 this pain is related with the acid or gas formation, indigestion. All these things I will differentiate you one by one, so that you can at home, before you go to the doctor, you can identify it, what type of pain I'm having, so that you can go directly to the appropriate department to get help easily and fast. So I told you the second portion, from right to going left side, the second portion is, the middle portion is the epigastric area, which has in it the esophagus, portion of the esophagus. It has the cardiac orifice. It has the stomach. It has the head of the pancreas. It has the duodenal portion. It has the bile duct. So these are many things, and they are having different characteristics. Or if they are sick, they have different characteristics, that I will tell you, so that you can recognize it later on. So now, from this area, when we travel towards the, so one thing I forget, there is transverse colon, which is coming the large intestine portion, which is coming from right to the left side. Transverse colon is also passing from this area. So there are too many things in this epigastric area, or that's why this of big importance for the medical science doctors, to identify the pains, what type of pain patient is having. So tra- transverse colon, stomach, pancreatic head, and duodenum, bile duct. So all these things are in this area, and all these organs are having different characteristics of pain if they become sick. And I will let you know about this one. One more thing I would like to tell you, this in this area, because this is more important. And above that, to protect heart, to protect lungs, the most important organs of our life, they are protected by the ribs. Chest is protected by the ribs, the bony cage. But here, I told you these are many more important organs, but there is no bone. But to safeguard these important organs here, just under the partition of the ribs, this area, central area, has most important organs functioning for the body. And to protect these major important organs, God or the nature has given two type of soft links over there. Bags, you can say that one. Soft bags. And they are made of lymph. They are made of fat, and they are known as omentum. Greater sac of omentum and lesser sac of omentum. These are started from the ribs, goes downward, and covers this area. And first of all, there is a big bag, that's known as the greater sac. omentum. And above that one, because to cover this area, more important cardiac area, more importantly, that area where the food pipe is joining with the stomach, there is a lesser sac above the greater sac. And that greater sac goes up to the umbilical cord. Lesser sac lies only in this area. And even if you can see your abdomen, and you will see that this has a soft area, projected area, just bump, bumping out area, because the nature has protected the underlying organs by these protected soft things, because there is no ribs. If ever anybody hits here, underneath organs are not hurt, because this is a fat deposition. Two bags of fats are lying here. One is a greater sac of, the other one is a lesser sac. Well, lesser, okay. Omentum, greater omentum and lesser omentum. These are two things over here protecting all these. And even these two lymph organs, these two fatty organs may have some tumors, may have some problems. That's also individually identified that, oh, this has a different type of problem. This is not related with the stomach. This is not related with the pancreas or liver or anything else. This is related with this momentum. So that I will also characterize to you. Now, from second area goes towards left side under the ribs, under the ribs, and from the left side of mid clavicular line, from the left side mid clavicular line, left area from that side of the abdomen under the ribs is a spleen. And about spleen, I have told you that the major function of this spleen is to clean the blood cells, basically clean the blood cells from any disease or anything else. Suppose just a person is going to the police, and he has got the training, and after the training he is recruited. Bone are making the cells. All the blood cells are made in the long bones, and they are transported via the blood, and they goes to the spleen. Spleen is their office, who judge these blood cells that they are normal to work in the bloodstream or not, because there is different function of the WBCs, different function of the RBCs, and there are different WBCs conditions. So all they are having, there are different functions, but if they are normal in contents, then and only then they can have a healthy life. So this spleen is the office, you can say, which can scrutinize that these cells which are made by the bones, now they are healthy to go for fight, to go for life. So that spleen organ is lying under the ribs on left side. And also, if anything happens in any of the organs, and that organ is producing more toxin, that organ is killing more WBCs, more these blood cells, just like cancer. Just because I'm naming the cancer because it's easy to understand, but there are some other diseases. In every disease, even we have injury on our hand, and you see in your axilla, armpit, you have a tumor like projections. Okay, the same thing you can have inguinal area, but it's not only these two areas. There are different other areas. When any organ has injury, has damages, is producing more garbage, and that garbage is going back in the blood flow, and that blood flow has filtered the toxins time to time in different areas, so that the normal blood can go circulate throughout the body, and this toxin, this poisonous substances plus these cells should be arrested just like the jail. We put some people in the jail because they are not supposed to live in the society. So we put into the jail. So they will destroy, if they go to the society, they will destroy the society. The same way, the cells coming from any toxic area and diseased area, if they are excess in quantity, they are filtered in a different channel that is known as a lymph channel. They are filtered from that one, and then time to time they are stored in axilla, in inguinal area, in a neck area, and different other areas. And I am talking about the spleen. So when they are overloaded, suppose the jails are overloaded. When the jails are overloaded, where the other prisoners will go, if there are more prisoners, where they go? They are sent, or some other special areas are made, and they are transported to there, just like the hard jail. Most of the from various states, the prisoners are transported to the Tihar jail in Delhi. The same way, when toxin is excessive, produced in any organs, and blood coming from that area has full of toxins, plus the dead cells, they go to the spleen. They go to the spleen, which is lying on the left side under the ribs. And the function of the spleen is to scrutinize them, test them, whether these cells are normal to work again in the blood cells, and it will be sent to the blood cells. If they are not, they are killed. That is known as phagocytic function. The spleen has a phagocytic function, means it kills them. They swallow it. Just like we make something with the mud, and that's not good. Then we dissolve it again. Again, we make the other organs. The same way, spleen dissolve all those cells, again send it into the stream, so that they are reformed in a new shape. Okay, so in this way, spleen's function is to reduce the toxicity, to wash out the toxicity, and the pure blood cells are sent back to the stream to work and function inside the body. So this is the more important function of the spleen, that all the toxin, just like a person is having malaria and kalazar and all those things, just like people are saying kala pili or something like that in India. In that, the spleen is enlarged because throughout the body, the toxin is produced by those malarial parasites. Toxin is produced, and the more toxin is coming from all around the body, more toxin is coming to the, and there is a big load on the spleen to clean up the blood, and ultimately spleens are enlarged. Oh no, I cannot take this much load. Tired up. Eh? So spleen is enlarged and comes out of the ribs. Normally, it is under the ribs. We cannot feel that one. But when it is enlarged, we can palpate it under the ribs. That's the danger. But there are other symptoms. I will let you know. I will let you know, because I'm just introducing the things that what are lying inside the abdomen and where it is lying, and what's the main important function of those one. But I will let you know in detail each and every organ. So ultimately, spleen we have recognized on the left side area, and also the function of that one, important function, plus the pancreas, just like I told you, it starts from the epigastric area, major portions, and its tail, its head and body lies in the epigastric area, and its tail goes to the left side. That's the left splenic area, or left hypochondriac area. Left hypochondriac area, where the spleen is lying. Underneath the spleen, there is a tail of the pancreas. And also, the large intestine, which is coming from right side to left side, the transverse colon, plus the splenic flexor, where the large intestine is turning towards the left side, turning towards the left side, and also turns downward. That turns downward is a flexor. Again, turn. That is known as splenic flexor. So that splenic flexor is also there, and both side, the some portion of the transverse colon and some portion of the descending colon. After that, the large intestine is descending downward, and so some portion of that one is lying in this area of the upper quadrant. So upper quadrant of the abdomen is divided into three portions by the two lines which are coming from the clavicle, mid clavicular line, and they are having these important organs. Right side is liver, middle side is the stomach and pancreatic head, the third side, left side, is the spleen and the tail of the pancreas, plus the large intestine is moving in all the three portions. So these are the main important organs in this area. Now come to the second portion of the abdomen. We have drawn a line that's known as subcostal line. Costa means ribs. Sub, where the ribs are finished here in the chest, and we are matching that line, subcostal line from right to left side. And under that subcostal line and above that transtubercle line, that is transtubercle plane, where we put the belt, and I told you that's the highest portion of the ilium bone, and this portion is also divided into three portions. Right side portion in between, just on right of the umbilical cord. Our umbilical cord is in the center. Just on the right side is known as right renal area. Renal means kidney. Right renal area means right kidney area. And not only the kidney area, there is, oh, sorry, there is, just one second. Oh, right renal area, there is another thing, important thing, that is known as gland, suprarenal gland. So that suprarenal gland is lying, I don't know what happened to my computer. Suprarenal gland. That suprarenal gland, supra means above, renal means kidney. Above the kidney, there is a gland that is known as suprarenal gland, but its other name is adrenaline gland. Adrenaline gland. And same way, on the left side of the abdomen, there is a kidney and known as the left renal area, and above the kidney there is a gland that is known as suprarenal gland or the adrenaline gland. Now, along with the gland and kidney, in this area there lies on right side cecal valve. Cecal valve is an area where small intestine joins with the large intestine. When we eat food, food goes to the stomach, stomach to small intestine, small intestine to large intestines. And small intestine is like a coil, the snake sitting somewhere in the coils, and ultimately many enzymes, many secretions, time to time are added to our food, and again it becomes liquefied, and most of the stuff is squeezed from this one in the small intestines, which is healthy vitamins, proteins, fat, whatever we have eaten has been squeezed from that one, and that is drained to the cisterna chyli, a one tank is in the backside of our vertebral column. There is a, you can say, a big channel covering on the small intestines, that is mesentery, that is known as a mesentery, that is covering, and all the squeezed material through the mesentery goes to that tank. I will tell you about that one because now the time is over for this one. So I will detail this thing in my next lecture, that how our taken food and it is digested and it is assimilated to make new blood. How this works, I will explain all these things. So these large intestine has ascending colon, cecal valve on right side, and descending colon on the left side. And in the middle, there is a coils of the small intestine, just like a snake is sitting. So we will come to the third position next day, so that you can understand in our abdomen what are the organs, where they are. And after that, I will tell you one by one for each organ, if they are diseased, if they are sick, how we can recognize that. Every pain, every disease is recognized by a pain, word pain. The shortest explanation of every disease is a pain. Oh, bhai, yeah, I have a pain. What pain? Maybe in the joints, maybe in the abdomen, maybe in the head. Why they are, that's a different and another story. Then this pain word is explained for different organs, what is their direction, what is their characteristics, so that we can recognize that this pain is in the kidney, this pain is in the liver, this pain is in the intestines, in different organs. I will tell you one by one each and everything, so that even at home you can understand that my pain in the abdomen is because of this, my pain in the abdomen is because of this. You can recognize at your home if you continue listening all these lectures daily basis. Then they will become a competent persons to diagnose to your nearest and dearest, and also to himself if you have any problem in the abdomen, very easily, and then go to get help in the hospitals in the appropriate departments as well. Or even you can get help by yourself, because you know that what's the problem and how I can relieve of this problems, whether it's a long term, whether it's a short terms, and according to that you can manage the things. Today my time is over. This is your Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Email address homeomedicine at yahoo.com. HOMEOMEDICINE at yahoo.com. Anytime when you are suffering from any disease at any age, and you want to take a second opinion, or you want to get treatment by homeopathic scientific approach, you can call me at 408 687 1899. God bless you all. Please remain attached and let your friends and nearest and dearest know about this thing. They can join friendship with me on Facebook, or they can join my channel, YouTube channel, Homeopathic Natural Medicines by Dr. Gurdeep Singh, or you can join Sabrang radio station, sabrangstation.com, www.sabrangstation.com. And you can go to tune in and you can listen all over the world this radio station, from morning till evening. There are different programs, Gurbani programs, filmi Geet Sangeet, and different skits. And at the evening time from 5 to 6 California Pacific time, I appears for your service to have health education lecture series. So please, if ever you are interested in anything, please come to this point about the health especially. Rabadaka, God bless you. We'll see you tomorrow in the different programs.